I'm Dr. Taylor Gregory, the VP of Animal Health and Veterinarian here at the Greensboro Science Center, and recently we took Rocco, one of our black howler monkeys, down to the hospital for an endoscopic exam and overall checkup. So Rocco is a little bit of a special case. He is a 7-year-old black howler monkey who's had quite a long history of diarrhea. We've been doing a couple different things to manage that diarrhea, including diet changes, trying different medications, but haven't been successful in managing it. So this was the next step in trying to figure out what's going on and how to best manage this for him and make him as comfortable as possible. So for this exam for Rocco, he was brought to the hospital and then we hand injected him with an anesthetic drug. Once he was at an appropriate level for us to handle him without protected contact, we brought him onto the table and then gave him inhalant anesthetic. And then once he was in a good position for us to intubate him or put an endotracheal tube in, we did that. And for howler monkeys, they are a little bit more challenging to intubate than our cat and dog like animals. So in order to intubate him, we used the assistance of a scope, meaning we were able to see as we put the ET tube or the endotracheal tube in, because they have a couple blind pouches that you can get caught in if you're doing it without that scope. We're very successful, got him intubated quickly, and were able to move on with the procedure. For Rocco, one of the things that we are interested in doing was an endoscopic exam. And what that is that's putting a camera inside both the mouth and going down into the stomach, and then in through the rectum to go into the colon. And that gives us basically a way to view those tissues and see what they look like, where we wouldn't normally be able to do that unless we went in surgically. So it's a much less invasive route to do that. When we were able to get into the stomach and see, all the tissue looked really good. And since it's not his problem, we decided we didn't need any samples from that area. And with the amount of food that was still in there, it would have been really challenging to get those samples. So we went ahead and brought the endoscope out and then went in through the rectum into the colon. He didn't have any lesions or anything like that that could have been present, but that doesn't mean there's not something there. So we were able to use a little device that goes and takes small samples from there through the endoscope, so that way we can send those out for a pathologist to look at and see if they see anything, essentially microscopically, that we can't see grossly or with the naked eye. In addition to the endoscopic exam, since Rocco was down here and under anesthesia, we wanted to do a full physical exam, which includes palpating all of his joints, his abdomen, taking a quick look at his eyes, his ears, his teeth, getting blood work on him to see if there's any blood work changes. All of his blood work, for the most part, looks relatively normal and similar to what he's had in the past, no significant changes there. So for Rocco on his exam, overall, there was nothing obviously causing the diarrhea. We do have to wait for those samples that we took from his colon to come back, and that'll come back in a couple of weeks. And once we get those answers back, then we can say, okay, what do we do now? What are the next steps? Do we try a different medication? Do we try alternative diet items? Where do we go from here? Rocco gets a lot of extra special attention here at the zoo, and we're happy to have him.